This is a global news report on the genetic role in gum disease and tooth decay by Natalie Wagaman. Genetics determine an individual's predisposition to tooth decay and gum disease. Recent research has made multiple connections between genetic predisposition and oral issues. Tooth decay and gum disease is most commonly associated with diet, care habits, and overall health and lifestyle. Genetic studies have shown why some individuals may be more prone to decay or gum disease despite their diet and at-home care. Amelogenesis is a process that defines the formation of dental hard tissue like enamel. This process is primarily responsible for determining the enamel's size, shape, shade, and even vulnerability to caries. There are two types of proteins that are responsible for amelogenesis: amelogenins and non-amelogenins. Genetic alterations within the proteins can predispose individuals to dental caries. A bacterium called Streptococcus mutans can also be found in a healthy dental environment. However, a person's unique immune response to this bacterium determines a degree of bacterial development in the oral cavity. A compromised immune system could provide the Streptococcus mutans a chance to colonize the mouth and raise the risk of dental caries. Fructose 1-phosphatase aldolase deficiency occurs in patients with genetic fructose intolerance. Fructose is a sugar just like lactose and glucose. When such people consume fructose, blood glucose or blood sugar levels may plummet. This causes symptoms including pallor or like whiteness of the skin, vomiting, and even coma, along with a long list of other symptoms that can happen when someone is experiencing a diabetic episode. Many of these patients do not eat fructose, and because of that, they also don't have cavities. The hereditary sensitivity to bitter taste is also another critical factor that has been demonstrated to enhance the risk of dental caries. The three types of hereditary sensitivities are type AA, type PP, and type AP. The type AA with two bitter insensitive alleles known as non-tasters. Type PP is two bitter sensitive alleles known as supertasters, and type AP with one of each allele known as medium tastes. Children who fit into the category of non-tasters, type AA, have been found to have a significant incidence of dental caries. It's thought that those who aren't tasters can't distinguish between sweet and bitter flavors. They require large doses of sugar to taste anything. Non-tasters are, hence, more vulnerable to tooth cavities. According to studies, women who are more likely to experience dental caries because they produce less saliva than men, reduce salivary flow, impairs the pH buffering ability and remineralization process, raising the risk of caries. The reason why fluoride is super important in oral care and in dentistry, and why your dentist always pushes it as well as your hygienist, is because fluoride is an ion that actually remineralizes the tooth enamel when it's weakened, and so that's again the whole point of remineralization is to just restore the minerals in the weakened enamel to prevent caries to prevent caries and to prevent the enamel structure from breaking down and causing more caries, or causing an easier path for the caries to infiltrate. Antimicrobial peptides, or AMPs, are natural antibiotics found in saliva. AMPs serve as the teeth's natural barrier against dental cavities. It also helps to restore the oral cavity pH to its normal pH, especially after you drink like a soda that's acidic. Your saliva is super important in helping restore your normal pH to your mouth to prevent cavities. According to research, the rate of caries incidence is defined by a genetic predisposition to a lower concentration of these peptides and a difference in salivary AMP concentration. So this study has found that the rate of caries showing up in individuals in this study that was defined by a genetic predisposition. Not only did some of them have a lower concentration of the antimicrobial peptides in their saliva, but some of them also had a different concentration, which means some had more than others of the antimicrobial peptides in the AMP concentration. Another risk to oral health and cause for concern other than tooth decay is gum disease, or also known as periodontal disease. Periodontitis is the inflammation of the bone and surrounding gum tissue of the tooth. So periodontitis is referred to as an inflammatory disease that affects the gums and bone in supporting the teeth. There are two forms of periodontitis: aggressive periodontitis and chronic periodontitis. Epidemiologic studies found that families with a higher rate of aggressive periodontitis revealed that genetic factors contributed to more than 50% to caries in children and 25% in adults. This study also determined that there are now around 38 genetic genes that have been shown to be related to periodontitis and periodontal disease. The reason why saliva is so important is because it helps maintain a healthy oral cavity and good tooth health. There are 3 ways that saliva does this. Saliva contains enzymes and antibodies that can directly attack the bacteria of dental plaque. Saliva neutralizes acids released by decay-causing bacteria. Saliva contains minerals including calcium, phosphate, and fluoride needed to replace lost minerals from tooth surfaces. This slide here is just of 3 different icons. Each icon has a video embedded within it that goes over the processes and the progressions of tooth decay, gum disease, gingivitis, periodontal disease, and all other oral health complications that were discussed in the presentation today. So those are just supplemental materials you can view on your own if you would like.